optimal criteria for cord blood unit selection are unknown. Recently, however, data has suggested that donor-recipient match criteria should be upgraded to 6 allele or higher. Although how to clinically implement this and how it could affect cord blood unit selection is unknown. At Memorial Sloan Kettering, we analyzed the HLA match grade of the grafts and 1 to 2 units of backups that were chosen for 100 double unit cord blood transplants. We found that the units that were currently chosen based on HLA A and B antigen and DRB1 allele had a very high degree of mismatch when typed at a higher resolution, with as low as 2 out of 10 for 4 out of 6 units. We then evaluated how often the use of higher resolution of HLA typing would change graft selection to substitute one or both of the backup units over the units that were transplanted. If the cryopreserved TNC was 2 times 10 to the 7th or higher, and a better HLA match were required for either units 1A and 1B to be replaced by the backup units, the frequency that the graft selection would change was up to 38% of transplants. We conclude that adoption of a higher HLA match grade criteria will frequently change the selection of the optimal cord blood graft. And while the new lower limits of HLA match and how to trade off higher resolution HLA match against TNC dose are still unknown, our data suggests that consideration of a higher resolution HLA match is possible without any significant compromise of the cell dose. Ultimately, larger studies need to be done to understand the impact of higher resolution HLA match on disease-free survival to further guide clinical practice.